again, thank you everyone for being here tonight. We all got a chance to share our story. It's going to be more of just an intimate group in this regards, and that's all good. But either way, looking forward to sharing this with you. So as it says up on the title screen, title tonight, Step Strong, Stay Active, Natural Solutions to Reduce Foot and Ankle Pain and Stay Active as You Age. So just presented by me, I'm Dr. Jereme Trunk. Share a little bit about my story here in just a moment. This is me and my lovely wife, Sarah, co-owners and founders of Balance Within PT. We've been around for over 10 years at this point, helping our community, helping many individuals with a lot of whether it be chronic or straightforward problems to be able to find different options and natural solutions to get over the hump and get back to living their best lives. So just quick housekeeping with this. Well, it's already being recorded. This is going to be recorded. Going to be answering questions at the end. So we'll try and keep as much information confidential as possible. But please feel free to anything you feel called to ask as I'm going through this with it. Sometimes in a smaller group, I can stop and answer questions, and then sometimes we kind of we'll save all the questions for the end there with it. If you feel like you might not remember it, you could always put your question into the chat, and then we can always just return and circle back at the end of the session with that. But if you don't want your face to be shown on the replay, you can just turn off your camera. Please make sure the mic is muted just to minimize background noises, although you guys have done a good job with that, and I'm kind of just playing the MC on this and kind of muting some of you guys as I'm going along with this. But and then this is meant to be for informational purposes only. This really cannot necessarily replace a thorough evaluation by a specialized physical therapist, but hopefully this does give you some good insight and next steps, no pun intended, but next steps on your journey with this. And then we will still have the free 55-minute treatment session raffle for those attending live, and some bonus offers given to those attending live through the end of the class. So why we are doing this. So as I mentioned, we've been around for over 10 years at this point. So we were founded in 2015, really to just solve a problem that most people that are dealing with pain and they're frustrated know too well, trying multiple treatments and still not getting lasting results for what they want. So after me personally, I've dealt with this. This was one of a personal and professional journey with this, but after personally dealing with back, foot and shoulder problems for over 20 years, I've learned that there was a better way. This is with the practice that we built to deliver it. So proud to help solve complex cases when traditional approaches have failed, such as looking beyond the pain, myofascial release, or breathing. Today, we've helped over 1,000 people get back to doing what they love, especially those who've, quote unquote, tried everything. 115 plus 5-star Google reviews and 5 times rated in top physical therapists in the Lake Country Family Fun surveys. So at our organization, just one of our main taglines, we help people age over 40 plus looking for physical therapy find lasting solutions to aches and pains naturally so that they can get back to the active lifestyle that they want without unnecessary medications or surgeries. Who is this class for? So class is not just for someone really just looking to limit foot and ankle pain. It's someone really looking to get to the root cause of the problem with it. So what does that mean in their world? Maybe that means hiking on trails with their friends, going for a walk with the grandkids, playing pickleball, walking in the sands on a warm, sunny day, especially in our summer season, unlike today, but in our summer season, working comfortably in the yard, and then ultimately have confidence in their body to work well for them as they age. So if this sounds like you, whether it is pain in the toes, the feet, or ankles, or the body, you want to be more active but cannot because of the pain and you're afraid of making it worse after, or you feel like you've tried everything, whether it be chiropractic, physical therapy, orthotics, acupuncture, meds, injections, or surgery, and you still hurt, or you've been told you just won't have to live with the pain, then you're in the right place. So what we're going to get into and what you're going to learn tonight is some missing links that can be driving your foot pain and ankle pain, probably driving you crazy. Problems with footwear, problems with orthotics, and then foundational concepts and exercises to help your feet and the body. And then as people come in here, sometimes they are looking for a specific cue or insight as to how do they fix their specific problem with this. And so I always want to share, don't just listen for your specific problem in this. I want you to pay attention to all these things because there's a lot of common threads and really every section is going to apply to you. So about me, I've been a physical therapist for, it's actually over 20 years at this point. Orthopedic, spinal, and foot pain specialist, advanced John Barnes myofascial release specialist. Recovered from chronic back, foot, body pain after suffering for over 20 years. Co-owner, founder of Balance Within Integrative Physical Therapy, again with my lovely wife, Sarah. Father, husband, avid hiker, biker, and musician. My story. So this is only just still a glimpse of it, but I try and highlight a few of these things in these classes because I don't want it to necessarily be about me, but I also want you to understand a little bit on how there might be some similarities in your journey. Um, just in terms of chronic pain or just problems that have been around for a long time from old injuries. So multiple injuries in my story from growing up into adulthood. Starting with, at least from this foot component of it, I had a broken bone in my left foot at age 2, and it was the first metatarsal. For those of you who don't know the anatomy, that's the bone that goes to your big toe. That is one of the most important joints of the body to be able to load through the big toe. I broke it at age 2. I don't know how a 2-year-old can break it, but somehow I did. I still have the script from the doctor from, I'll date myself, 1982, that shows a broken bone in the first metatarsal. And then on the other side of it, since I don't remember it, I asked my mom once, what did they do to treat me? She's like, they just sent you on your way. And they said you were too young to worry about you even being impacted from it. So I know, not with no casting, I don't know if I would have needed it or not, but from the standpoint of how my foot formed on the left side, it did form differently than the right side. And so that has always impacted my body growing up as well, including then tearing my ACL on the left side about 10 years, no, not 10 years, probably about 15 years later. I wore orthotics from age 7 on. Oh, there's the torn ACL, age 18. Not surprisingly, on the same side as that foot fracture. And then from some of the other stuff, though, in terms of how this journey of physical healing has affected me, major ski accident at age 14, spinal injury. With that, I had subluxed, meaning kind of traumatically rotated vertebrae out of place in 3 different areas that was missed for over 10 years, including imaging, meds, PT, chiro, acupuncture. Everything helped, but nothing truly got me over the hump with that. And as some of you may have heard maybe on your journey with this is something I've heard multiple times on my journey, is that you're just going to have to live with the pain. Always one of my most frustrating things with it, because I always say that there's got to be something that can be done to still make it better. Even if for some complex cases, what does 70% mean in that body? So turning points for me, just learning how the body works together as a system, whether it be myofascial release or how the feet impact the rest of the body, or understanding what the core really is, such as breathing and beyond. So today, no meds, pain-free lifestyle. When I highlight lifestyle, means I still continue to take care of myself. I still continue to take care of my body as a patient and as a professional with that. And then use that. For me, it's been a big part of my journey, though, but helping people on their journey with that as well for over the past 20 plus years with that, overcoming their stubborn, whether it be quote unquote foot pain, back pain, neck pain. So bottom line is, if you're dealing with pain that won't go away, you're not alone. And more importantly, you are not doomed. Okay, but for me though, as in my story here, I am very lucky on my journey. It's not why I got into the physical therapy profession, but I think that was part of the reason that life set me on that pathway, is because I was very lucky that the older I get, the better I feel in my body. And I really do always believe that we have the capacity and the capability to improve and feel good in our body, no matter how long that pain has been there. So again, what I'm going to share with you are missing links that I use on my journey to help with my body, and then also what we help with teaching our tricky patients every day to help overcome their stubborn, whether it be foot and ankle pain or other body parts as well. So let's jump on into this. Love this quote by Leonardo da Vinci, where the human foot is a masterpiece of engineering and a work of art. Truly, it is amazing. And I know people sometimes can be grossed out by feet, but for what those feet do for us, for where they take us, literally what they do for us figuratively, of just giving us that support in our body with that. Our feet are amazing pieces of engineering and structures with it. It is truly just, it's an amazing divine structure that just still continues to amaze me to this day. Just a quick anatomy of this. Pay attention. There's going to be a test at the end of this. That's how you get entered into the raffle. Just kidding. Just want you to see with this in terms of just how much really is in the feet. 26 bones, 52 total, which including both feet, which means 25% of the entire body's bone structure in terms of just numbers is in our feet. So 33 joints, 29 muscles. That means 19 that are in the feet and 10 outside that influence it. And then potentially up to 112 ligaments in there, and thousands of sensory nerve endings that help with our balance, but helps with our stability, helps with giving us feedback of how we are interacting with our environment and the grounds. So the anatomy of the ankle. So really the true ankle joint only consists of 3 bones. So it's a mortise joint, and I try to give that example there. So anyone who has any woodworking or carpentry experience or knows someone who does, a mortise joint is a bit what you can see in that image right there on how that fits, how that piece of wood fits into that opening right there and creates stability with that. So there's the talus bone, which Kathy had shared with us in terms of her impact on how that really was really a big piece of her journey with that. And then that tibia and fibula, so those 2 bones in our lower leg that go down to the ankle. So that's truly just the ankle joint right there, and the rest is the foot. But it all has to work together. So what causes foot pain? It's always a loaded question, but the most common summary is that footwear, whether it be, and then moving on to whether it be weak, like a weak foot or weak feet, the muscles in the feet, or the leg, the hip, the core. Stiff muscles is that foot able to move and change directions with that, or is it just always acting as one just kind of solid clump of material trying to interact with that? Surely the feet need to change shape and still be rigid at the same time. And if everything is stiff and it's not changing shape, that is a big problem in the long run for every step we take. So then other factors, whether it be how we sit or we stand all day, our posture, full body changes that can still impact the feet. But these all add up to one big problem: mechanical imbalances. When I say mechanical imbalances, that's the muscles, the joints, nerves, the fascial system, which is the connective tissue of the body, and then just even body alignment. But there is good news though with mechanical stuff, is that is one of the most addressable things in the sense of where majority of research has shown is that 80 to 90% of all foot pain is mechanical. I wish it could be just as easy as this one right here with the little gingerbread man there. Well, that's why your feet hurt. You got candy corns. That poor little guy over there and those little candy corns with that. It was just as easy as pulling off those little sugary things. That, man, life would be a lot easier for all of us, right? Top 4 common foot and ankle problems. So this is usually where most people usually have some sort of overlap of these problems with it. So it'd be plantar fasciitis or heel spurs, Achilles tendinopathy or tendonitis. The medical community has kind of gotten away from just tendonitis and just groups it into tendinopathy. Bunions, or then moving on to forefoot pain near the ball of the foot. So if anyone has had these words shared with them, neuromas or metatarsalgia, those are just irritation to the ball of the foot, and a neuroma is a pinched nerve in the foot. So as we get into it right here, plantar fasciitis or heel spurs, it's just pain near the bottom of the heel, maybe pain first few steps in the morning after maybe sitting for a while. Often some of the big drivers with this is maybe weak feet and leg muscles, and then that fascial system takes more of that load. Or someone who maybe doesn't have flat feet. Sometimes some people have come in and say, I have high arches, and my arches are not a problem. Sometimes in those individuals, if it's more higher arch, that means their foot is more rigid and they don't get good shock absorption with that. And so we still need to work on making that foot still a little bit more pliable for them. Or it could be the other side of it where you overpronate and you just don't have good stability to support that plantar fascia. Tight calves. Tight calves is a big thing as well, because the calf musculature, there's a lot of research that shows that the tissue in the calf is one continuous piece of tissue all the way into the bottom of the foot. So it's not separate. Even though like they impact it, but there are some realms of medicine that say it is just one continuous piece of tissue with that. And then heel spur, I always try to educate, a heel spur is not necessarily what is causing your foot pain. Can you have a heel spur? Yes. Can it be painful? Yes. But a spur, oftentimes people will connotate a spur with something sharp and pokey. Fair enough, right? But really what it is, if we look at this diagram right here, where if you look at the heel and that heel bone, how there's that little part that coming out that shows like that heel spur. What that really is, if we truly were to look at it from the bottom of the foot, it's almost like a shelf. So it's actually a little bit more of an elongated piece of bone with that. And what it is that when it's tight tissue that continually pulls on there, the body starts to lay down more calcium. The body starts saying like, hey, you're pulling on me. Okay, I will start extending my shelf out to meet your demands. And then when they x-ray it from the side, and then from the side view, it looks like a spur. So not saying you can't have pain there, but sometimes some people will get attached to that component that I have a spur sounds sharp, so that's where my pain is coming from. So that means that's limited help for me, or maybe I need surgery. And that's not necessarily true. It just means the bone's laying down more calcium to it. You still need to address the tissue with it, but a spur is not necessarily poking and jabbing into the tissue as it oftentimes maybe feels like, but really how sometimes people interpret that information. Achilles tendinopathy / tendonitis. So big things, tight calves, weak calves, and they can be both tight and weak. Contributing factors, use of heeled shoes. So when I put heels in quotation, some people say, I don't wear high heels. It doesn't even have to be high heels. In the truest sense, in the purest realm of how sometimes some people look at the foot, if anything on that heel is higher than what's in the forefoot, they're going to still say that is still considered a heeled shoe. Some people need that. Some people, between how long things have been tight or how things are maybe behaving with that tissue, sometimes that heeled shoe is a benefit to them with it. But that standpoint, though, of wearing heeled shoes that modern society has put us in for a long period of time always has our calves placed in shortened positions. Other contributing factors, just decreased use, sitting for long periods of time. Like we as a society sit more than we ever have throughout our evolutionary process as humans in this entire, well, at least recorded history of humans. And then weak muscles, weak foot intrinsics. There's lacking the strength in the foot itself to be able to push off for walking and running, and it's overloading other structures nearby with that. Bunions or bunionettes. So most people are familiar with bunions where the big toe moves, but some people maybe have familiarity that little toe can start moving towards that midline as well. So that big toe and the pinky toe start pointing towards that midline of the foot. Other than like some of the other components I was just mentioning before, which contribute to this, one of the things that stands out with this one is just poor ankle and midfoot mobility. That's meaning that the foot is having a hard time changing shape with each step. It can't go between a rigid thing to push off on and something pliable to meet the demand of what the ground is giving them with that. So, oh, come on now, don't need these updates. Love how when I do this, it always pops up random updates on me. So the ability for the foot to change shape, if that's not there, the forefoot is going to try to move a bit more. And then that starts changing the shape and the function of how those toes were truly meant to be used. And that contributes to sometimes those bunions forming as well with that. Again, poor foot strength. We're hearing that on a lot of these, right? The past two, now this one right here, that poor foot strength. Too much force is going on the passive structures. In this case, our big toe and little toe. And then narrowed toe box shoes. We're going to get into footwear in just a moment here. It's one of the big things, just most people don't even have on the radar with that. And so sometimes some people say like, well, my shoes have good cushioning, it has this, it has that. But a narrow toe box, in general, like the change is happening in the footwear industry to give more wider toe box options to individuals. But for the past 100+ years, majority of the shoes that we have been exposed to, our parents and maybe even some of our grandparents, would be considered narrow toe box shoes. And it started all from just basically fashion and styling with it, where they just kind of like that tapered look to how that toe goes into just kind of like that point with it on the shoe. In reality, that is forcing our foot into an unnatural position and causing us to have to use our foot in an unnatural way. And that is a big driver of this. And then the last one here, the forefoot pain. the metatarsals, and the neuromas. So just again, pain in that front of the foot with that. So increased loading on that forefoot. Again, heeled shoes would contribute to that immensely. And someone who has worn high heels before in the past, even if it was maybe 30 years ago, sometimes like that aspect of how that tissue has gotten stuck in that position still has, in part, a bias for you to load more that front of that foot. So between the heeled shoes and then the compressed forefoot, we're seeing two things right here with the footwear we're going to get into in terms of that getting out of that heeled shoe. And this is not always a one size catch all, but this is where the ideal is. Getting into what's called zero drop, where we start to get to the same height from the heel to the forefoot and a wide toe box. Because all of those things, when that starts compressing our foot, we get weak foot muscles. And once again, as you see on this slide right here, weak foot muscles are one of the big contributors to that. That's been one of the biggest common threads with each one of these problems. So it just means then you just get improper push off, or you're maybe not pushing off through the big toe and you're pushing off through these little toes. And those little toes were meant to help take force, but they are not meant to be the primary force distribution for each step that we take. That's why our big toe is the big one. It's supposed to be taking that force, not those little guys. All right. So some of these driving factors of foot and ankle pain. This young man has it down. You know, he's over there yelling, probably yelling at his mom and dad, these shoes are going to give me problems many years down the line. You let it be known, young man. You speak that truth right now. And how did that kid get behind the wheel? Shoes. Okay, we're just getting into shoes right now. Does this look familiar? From the standpoint of not only just the footwear, but looking at some of the feet within those shoes. If some of you have already started to have been beginning to deal with or have dealt with some of those bunion formations or that bunionette, or we talk about that forefoot compression, just look at the overlay in the middle of this slide right here. You see how those shoes are pushing our feet inwards with that. That is something, again, that's not only compressing things, that is diminishing our capability to use our feet properly, weakening the muscles with that, putting more load on the passive structures, the ligaments, even like compressing more of the nerves with that. So this is why footwear still makes a big difference with this. You can do corrective exercises. Corrective exercises are immensely helpful and needed. But if we're doing corrective exercises and we're going into something that's trapping our foot into this compressed position, and we're doing that for most of the day, those corrective exercises are only going to go so far. So the problems with that, let's kind of just going into it right now, that narrow-toed shoes puts constant pressure on the toes, changes shape of the forefoot. Again, does this look a little bit familiar? And then once this starts to happen, you lose foot stability, less ability to use that push off of those small muscles in the feet to give that foot that support to be able to push off with each step. This impacts our balance in the long run. It might cause our feet to flatten further, and then it puts more pressure on those lesser toes. So again, that component of that neuromas, which is the compressed nerve, or metatarsalgia, which just means irritation of the forefoot bones. More problems. So anyone who really has worn heels before in the past, heel shoes put the calves in a shortened position. They look great. I'm going to be honest with you. Like, I love seeing someone on a personal level, someone in high-heeled shoes. It looks great. Maybe that's just because how society ingrained that in me. And then on the other side of that, my PT brain's like, oh man, that person, their back, their hips, their feet. Like it is not kind to the body with this. Here's a little bit of that math equation in terms of, if you look at figure A there, that person's standing up straight. Figure B is where that heeled shoe puts them at an angle. And then figure C is the compensation that body has to go through to be able to just stand up in that shoe. That goes beyond the ankle, it goes beyond the feet, that goes into the hips, that goes into the back. And when you start changing the shape of that spine, what do you think is going to even happen upstream? What do you think is going to happen to your neck or possibly shoulders? Domino effect. Everything's connected in the body, but with the feet, that is our first point of contact with the ground. And if that's off, that's going to go all the way upstream with that. So in that regards, research shows that people who regularly wear high-heeled shoe wearers were 2 to 3 times more likely to develop a bunion compared to those wearing flat shoes. So the research backs it up immensely with that, but Society, I'm not going to go on a platform telling people to stop wearing it, but for people to be educated with it, education is power with that. And then if people just wanted to say, I'm going to deal with this now for style, look good, feel good, and deal with it later, so be it. There's plenty of therapists who will be waiting for you. So after hearing that, this just goes to show Cinderella is proof that a pair of shoes can truly change your life. Poor Cinderella, that glass slipper was probably terrible for that back, compressing those toes. She might have gotten that happily ever after with her prince something. Oh man, I was gonna look back into it. I'm a girl dad too, and I can't believe I still got this. I don't remember who she ended up with. Either way, though, I don't think that shoe did her good in the long run. Maybe got her husband though. So a contributing solution to this. We've just been talking about footwear for this. And so again, those two main changes in the footwear industry now that have really taken a lot more shape in terms of giving people access to, oh, Charming. Prince Charming? Is that what it was? Okay, cool. Um, thanks for chiming in with that, Cindy. Um, But contributing solution with that, I've touched base on it in terms of these concepts, but here it is right there. If you're looking at shoes, even though it may not be one size fits all, the ideal right now is getting someone in a wide toe box shoe, letting the toes splay out, letting them give the body more balance, being able to use those muscles in the foot more effectively. And then two, a zero drop sole, meaning again, that it's the same height from the heel of the shoe to the forefoot of the shoe with that. And if someone needs more cushion, so be it. It's still the same height. But is one higher than the other with that, that still is always having those calves and the ankles always in that shortened position. And again, depending on each person, sometimes we still say like, you might still do better with a slightly heeled shoe with that based on, excuse me, your history and your presentation with that. But as you move forward and opening up the feet and you start opening up those calves and those ankles, we want to make sure though that as we move around, we're putting ourselves in position to be able to maximize it and actually be able to not be going backwards or saying like, hey, I did these corrective exercises. This feels great. Now let me compress this and start to reduce that function of all that work I just did again with that. So again, not a one size fits all approach, but this is where the gold standard is. So another contributing solution is orthotics. And so in the beginning of the presentation, I put one of the one of the problems with orthotics is. When I say problems with orthotics, it's that individuals who maybe are being told to or have only tried saying like, hey, my feet are bothering me. Let's just put something in there to support it. Does it help? Yes. Does it help decrease pain? Ideally, yes. And at times it does. And we use orthotics here. This is actually one of our scans from our 3D scanner that we use to look at this for custom orthotics. But the thing is that what else is going on outside of that foot? If I support that foot, is that all of a sudden going to make your glutes stronger? It can help get them to activate a little bit more. Or is it going to get those calves stronger? It's not going to change everything all of a sudden with that. Sometimes it's been going on for so long. You do need to get into those areas, do something corrective to it, and be able to actually still make sure that you're balancing out the rest of that body. You can see on the right side of this diagram right here, and this is a real foot scan here. So I got the name crossed off with there. This is someone whose one foot was collapsing a lot more than the other one. And this is the algorithm that the machine of the 3D scanner will match up with the body. And I'll be honest with you, for just it being a computerized algorithm, it matches it up probably about 80 to 90% of the time correctly in terms of how we see that person present within the clinic the rest of the way up the stream. So my thing is about this is if you put something underneath there, how long has this been going on for? Like, is that pelvis still out of alignment? Does your back hurt? Does your knee hurt? So all of these different things then about how is this now impacting things upstream, and then how long has that been going on for, that a passive correction is not necessarily going to get to the root of the issue, but just be more so a contributing part of the solution. We always say it's a piece of the puzzle and it's not an end all with that. So then a broader view, just a little bit of a broader view here. So in our galaxy, here we are. So just taking a little bit of that zoom out here. So we've been talking about the feet a bit more. Of course, this is the class with that, but I want to start opening your eyes of what I was just talking about. What else is going on in this body? So don't worry about all of these numbers, but this is just some research that I pulled for this right here. And I could just tell you just the main summary of this, just so you can just have the main takeaway of it. So don't worry about it that like, hey, I'm not a student, I'm not a clinician, I don't need to know about this stuff. Like, it's okay. Just pointing out just to try and correlate with maybe something that resonates with you. So from the standpoint of someone who has knee pain, so based on this study right here, there was a very high correlation with someone who has knee arthritis. 76.8% of them had flat feet. And for all of those who had that flatter foot, compared to all the other feet in that study, all of them had higher levels of measurable knee pain with that. So again, that flat feet, I put it's in quotations because sometimes flat feet, you can still have high arches, but still have those feet collapsing on you. It's still a lot of those same things we were getting into before. What's the stability from the feet doing from that ground up with that? But we can see it right here on how there's like a near, 75 to 80% more high levels of prevalence of knee arthritis and knee pain with people who have problems with their feet. And then this right here, high prevalence of foot problems in the Danish population. So basically all this was just saying is that with this study, this was done for people aged 55 plus. And basically the study was that, hey, if you have pain in your foot or ankle, do you have pain anywhere else in the body? And 55% had pain reported in other parts of their body if they have pain in their foot with that. So again, there's that problem with things going upstream. So those wooden shoes, terrible, terrible for your feet. And not every problem is created equally here with this. So I just kind of put some of this in here. I'm not going to overly speak to what each one is doing with this, but I kind of talked a little bit about two of these pictures right here, the high heels as to how that changes alignment at your hip and your back. And if you don't wear high heels, if you got tight ankles, that type of equation is still going on up the chain with you. That's still going on upstream. Or even just on the picture on the right, which I just had up there from the foot scan, if one foot's collapsing more than the other, you can sometimes see that big asymmetry going up the chain. What's that doing to the pelvis? Does that person still have low back pain, or is there neck pain going on there? There's a whole cascade of events that can go happening from the ground up when that foot is not doing its job. But the common thread with all of this, everything works best when working together. So in a sense of like medicine, why do we always go into these specialists saying my foot and ankle bother me, and we just look at that? We just see all of these studies that show these prevalence of foot problems with other problems in the body. I'm going to share a couple other studies on the next couple slides in terms of how the impact of strengthening certain parts of this body will impact other areas as well with that. So just like a symphony, when things are working better together, it sounds nice. And then in regards to the human body, we want it to feel nice with that so that you can walk and move better with this. So in terms of then just some of these studies that talk about that component of how when we get into strengthening other parts of the body, getting away from the foot and ankle, how that can still positively impact that. So the top one here, it was just a study that was the effect of strengthening your glutes versus then just doing foot strengthening itself. So just the bottom line was that, so for the group that strengthened just the feet for 4 weeks, reduced their arch collapse and discomfort by 33%. But for the people then who did the feet and their glutes, reduced it by 68%. And then even just from that standpoint, we're going to go one step further, is that we want our glutes to work better as well, because a lot of times we maybe have been in therapies before, and the glutes are always the notorious suspects. You need stronger glutes, you need stronger this, we need to talk about the core with this, because if we work the glutes just by themselves, it gets stronger. But if we truly get the glutes to work better with the core, even with this study right here, it was an over 100% improvement in glute activation when working with the core. So you kind of see this whole effect here. Just the feet, maybe 33%. Feet and glutes, 68%. This is a different study here, but from that component of we get our glutes stronger by working our core, then we get that whole chain. Then we get that whole chain working better together with that and giving it better stability with that from the top down and from the bottom up. So the unfair blame game, sometimes some people will come in and have low back problems, core problems, and whether it be glutes or something with that, as I just mentioned before. So really, like, is it fair to expect our feet to work optimally when others aren't doing their job? So like if the feet and glutes are our co-workers carrying a heavy box, and the glutes aren't carrying the load, the feet are going to get irritated. But then the glutes are saying, well, the core's not doing its job there, so how can I do my job? And then the low back and core is saying like, well, both you guys aren't doing your job. Everyone's just pointing fingers. Everyone needs to work together with this. So what's the solution? So in that regards, for anyone who's a Harry Potter fan here, like you're a wizard, Harry, but then fixus helix valgus. Now that's more of like a little like inside joke, but helix valgus that's the medical term for a bunion. So I wish it was easy as just waving a wand and casting a spell and fixing that. Honestly, for all the people I've seen suffering with this, my mom has had bunion surgery years ago. She's had a lot of problems up her body, up the chain, knee replacement. Man, for all those years, I wish it could just be this easy with it. But learning how to take care of your body and getting to the root cause, build a stronger foundation for your feet with your hips and your core. Learn about your specific imbalances, whether it be tight tissue, weak muscles, along with maybe some foundational body principles like the alignment. When I was looking at that crooked man figure there with that pelvis off, if we put an orthotic there, but that pelvis is still tilted, that's still going to put more force on one foot over the other with that. Mobility and stability. Learn how to strengthen into functional movements. Learn how to walk a bit better. Stop getting out of that, or we got to stop trying to get stuck in that, it hurts, I'm going to walk this way. At times there's a right time and place to just meet your body where it's at, but we don't want to stay there forever with that. So we want you to walk and move better and be able to move more freely with that. But sometimes we need to still kind of do some of that localized strengthening or fixing those imbalances in the body before you're even able to move better with that. So in a sense, getting to the root of the issue, usually we kind of look at it as almost like more like a 4-step kind of a thing, even though they kind of overlap. So step one for everything is always trying as quickly as possible, getting you out of pain. So whether it be like decreasing muscle spasms, like with myofascial release or dry needling, or maybe cupping, or maybe some pelvic rebalancing, just looking at what are the main low-hanging fruit opportunities for you to get a couple things back in place in your body to start feeling better as quick as possible. Then addressing the root causes, improving symmetry, improving the coordination through local foot and ankle exercises, along with like full body assessment and treatment such as core activation, and then activation of weak and underactive muscles such as hips and glutes, and maybe the feet and calves as well with that as some of the usual suspects. Then we want to strengthen and get you into functional movements. All right, so if we're going to look at just, hey, this is stronger, I can do this exercise on the bed. What happens when we get up and move? Are the muscles going to be able to work just the same? Ideally, they work better, but sometimes they do need to get trained in more in that weight-bearing position with that. So in that sense, we want to get you stronger so you can learn how to walk and move better, build out your toolkit so you have tools for life, learn how to take care of your body better, learn how to be able to manage any fluctuations, any flare-ups, and then still have the tools to be able to still strengthen and move beyond that. And then beyond those levels right there, build a solid game plan to help just keep you feeling better. Whether it is sometimes some people just say, I want a whole program. I want to get back into Pilates or yoga. I like working out at the gym. I like doing workout classes. What are we doing to still just make sure that you are still moving your body? Because all of this stuff is making sure that you can still move. But if it's just, hey, I feel good when we do this, but I'm just going to sit all day. Well, it's only going to go so far. So we want to try and find some sort of routine that allows you to keep moving. And again, that good news, again, of all of this stuff is that 80 to 90% of this foot pain is mechanical, which means that addressing the alignment, stability, and mobility can greatly improve your foot and body and pain and your life. So even if you've been told or even have had surgery, there are still opportunities to be in a better place and modify your body with where it's at. So putting it all together, starting at the feet, Most common mechanical drivers of your foot and ankle pain locally. We talked about this. This is just a summary. Toes and forefoot are being compressed together, changing the foot alignment, mobility, and strength. Two, your foot and ankle cannot change shape very well. So sometimes people have heard that term pronation. That's oftentimes the one that gets demonized, but it needs to pronate and supinate, but it needs to be able to change shape. Three, muscles in your feet and the calves are weak. You're not able to support the foot with each step, and then it's just loading up all those passive structures. Four, ankle is stiff, whether it be at the joint or even like the muscles in the calves not allowing you to move properly with each step. And then five, the joint of your big toe is stiff, or maybe you're avoiding it. Maybe you're not putting force through that with it and overloading those lesser toes with it. Then the shape of your foot matters. So when we talk about that forefoot being compressed with it, what are some of the things that we can do? This is going to be in the stuff that's emailed out to you as some basic exercises with it, but sometimes we're looking at toe separators, looking at opening back up that feet. And then what are we doing then to work on opening up the tissue in there, or even some of those joints a bit? Some of the basic things that one can do is even just rolling their foot over a ball with that. But either way, though, we want to start opening things up. And with that foot needing to change shape, again, we can still work with the ball. But then depending on the individual, sometimes we'll have them start to step on maybe some uneven things. Maybe let's roll up some tiles. Let's get you to walk sideways on there. Let's get you to walk forward down there with that. Let's start to force your feet to have to change shape, because that's why nature designed us. Nature really didn't design us to stay trapped in a shoe walking on flat surfaces our entire life. It's our modern society, but that's not the way nature designed us. It designed us to be able to change shape. Walk over rocks, walk over tree roots with that. It needs to be able to change shape. And then they also need strength. So we've been talking a lot about that, a lot on these slides here, but feet and the calves are weak from either too much sitting or just disuse from overall activity. And again, with that design of walking on uneven surfaces, if we're not stimulating those muscles, there's some of that use it or lose it principle at play here. So the muscles in the feet are really like a springboard. So once we step, is that board nice and rigid for us to push off on, or is it all just collapsing on us with this whenever we try and push off? And then the solution, some arch building exercises and calf raises. Calf raises are one of the biggest and easiest ways to start giving support to the feet, because that contributes 70 to 80% of all the strength in the foot is just in the calves itself. So that's oftentimes why we will start with calf raises, is because that's one of the easiest ways to start giving you some options to get that foot getting some strength and stability as soon as possible with that. Open up the ankles, calf stretching with that. I'm sure just about every single one of you has probably done a stretch like this at some point in their life. So just putting that in there is just a very general, easy one to put in with that. But that movement right there, it's called dorsiflexion. That is also in the handout that I gave you. It shows that movement with that. But that dorsiflexion is a bolded and capitalized, is a key movement that can drive many problems upstream. Love it when we can open up an ankle joint and it can open up quickly and easily, because it is one of the easiest ways to restore so many things at the foot and ankle and into the hips, the knees, the back, and up that whole spine with that. And then the ideal is that too, after we stretch the calves, it's opened up now, great. And then the ideal is that we try to load that range. Whether we are doing that with toe raises or some squats, we want to be able to train the body to work into that new range. That is one of the things that oftentimes many people will miss in that journey with that, trying to get that calf to work better in terms of its flexibility, is they're not loading it enough into that new range for the body then to take into that and put it into use. Get the big toe moving. Some people have great toe mobility. Again, this is not always one size fits all, but if someone's toe is really stiff and you're not able to push through that with walking, that is such a huge driver for a lot of problems upstream with that. So I just put in there just stretching out the big toe and doing some toe yoga, trying to get the toes and the big toe to alternate and move and change positions with that. Start waking up and stimulating all those muscles in there once we start opening up that toe joints. And then beyond the feet, I put this in the home program as well with this. The bridging exercise right there, just something to start getting those glutes working, something to start getting those hips working and give that foot or those feet something to support it from the top down with that. So 3 bonus tips then. When walking, try to feel pushing off through the joint of that big toe. When walking, try to move and rotate through your upper body a little bit. This allows for more increased core activity as well as better force generation to propel the body forward. If someone walks and their whole upper body is stiff, part of that whole component of when we walk is that we're trying to just let our body momentum keep us going with it, not trying to have to just think and plod through each step. But some of us have gotten stuck in that, and that's okay. But that's what we're trying to break out of and try and get you back into more normal, healthy movement with this. 2 more tips. You're all awesome, 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 awesome. Thanks for all being here with this. I really do appreciate you guys being here tonight and sitting through some great information and hopefully learning some new opportunities to see your foot or problems in your body through a different lens. And then 2, you got this. Like there's opportunities to still always be better in your body and have an opportunity to still function better as we age. 2 real quick patient stories here. 55-year-old female, avid outdoor enthusiast, skiing, hiking, stand-up paddleboard, biker. She had a torn meniscus from skiing and had surgery, but then 8 months later developed plantar fasciitis on that leg. She had that for over a year, over 30 PT sessions, and by the time she came in, she still had 0 relief. So just a couple of key findings. She had immensely tight ankles with very weak forefoot muscles and weak glutes. So we targeted a lot of ankle mobility, loading it with squats and lunges. I know that's not going to be for everyone, but this was a very active person right away. Balance exercises, targeted glute strengthening, and we still added orthotics to her work shoes as well. She actually was a physical therapist, but she actually worked in the inpatient environment. So people who were just getting off of surgeries, getting them up out of bed. So skills in the PT realm, but just not as much in the outpatient orthopedic with it. But she was a PT on her feet all day in the hospital. Outcome 4 years later, still pain-free, still skiing and hiking. I see her maybe once or twice a year if something flares up in her body, but overall, she is just killing it. And then one other story here, 48-year-old active mother of 3, walking, biking, and gym goer, started to develop pain in both feet that continued to worsen. But she also had a history of low back pain, pelvic floor dysfunction, and then a previous history of plantar fasciitis. So key findings for her, very uneven pelvis, weak core and glutes, and weak calves. So our approach, we just started with calf strengthening and stretching. And honestly, in the first 1 to 2 weeks, that took about 80% of her foot pain away with this alone. Sometimes some people can get that much shift in a short amount of time with that. And then we shifted to working into the pelvic region, working on the alignment, working on the glutes, working on core strengthening, the outcome, improved foot, back, and pelvic pains, and just continues to maintain progress. And she's now missing her workouts from pain at this point. So, and there's a couple other patients who've been in here, suffered from our Google reviews, suffered with plantar fasciitis for more than 6 months, and it was affecting my gait and hips. Balance Within PT was able to get past this in a few quick months. I am back to golf, hiking, and travel. Thanks, Balance Within. I'm an active person that likes to bike, hike, and ski, develop plantar fasciitis in both feet. Doctor was talking about surgery, but taking the extra time to look back into my history let me move this. It was a long recovery due to all my other issues that were found, but I was happy to say I can work a full day on my feet with no pain, and hiking and biking and skiing again. Couldn't be happier. And one other review, I have used Balance Within multiple times over the last several years, and each time I walk away with positive results and the initial problem gone. Most recently, went for stiff and painful feet. Jereme and his team were able to end the pain with exercises and other modalities. The exercises have been easy to incorporate into my daily routine without adding more to my to-do list, and the whole team is wonderful. Love our team. Reminder coming up soon. For those who are still here to the end, you get entered into the drawing for the free 55-minute treatment session. What's it like working with the team at Balance Within? It's always 55 minutes one-on-one. You're not getting passed off. Oh, I said spinal specialist. This is a foot specialist. Spinal and foot specialist with this, but always one-on-one with your therapist. You are not getting passed off onto rehab aids. We listen first. We really want to understand your story, your goals, full body assessment, not always just looking where it hurts, and then really building a plan around your goals and what matters most to you with that. And then depending on what the needs are, whether it be specialized hands-on care to help get you feeling better faster, whether it be myofascial release, cupping, dry needling, etc. And then making sure that we're tailoring the home program for your body to make sure that you're empowered between your visits to keep being able to handle life's fluctuations and keep moving toward your goals. And then really tools for life, keep you active and confident in doing what you love. I always love that term, tools for life. I really feel like with the education piece of this, really educating people how to take, excuse me, how to take care of their body and how to manage it moving forward with that. I always want to say, like, I'm not fixing you. I'm helping to empower you to give you the opportunity to take care of yourself in the long run with this. Free consult offer, what's in it for me? Speak with our foot and ankle specialist, doctor of physical therapy over the phone, or come visit us in person and start troubleshooting your symptoms with this. So we want to hear your story so we can help get you to the bottom of what's causing your foot pain and what can be done. Find out what your options are for physical therapy and other treatments. Get more information so you can have clarity on what can be done so you can get comfortable and moving again. And honestly, though, like, I know what it's like to feel stuck, feel scared, and not knowing what to do with making a decision with it. So really, we just want to we love to be a resource and help regardless of whether we work together or not. And then for discovery visits, we do have one slot reserved for each person in the class today. Purpose of this, again, just a one-on-one session to just listen to your story, get an opportunity to go over your goals, make this more of a personalized session rather than just the general information that the workshop can provide for you and answer your specific questions with this. And also to discuss the natural ways to keep you moving and keep you more comfortable again. No pressure visit, really just more so an opportunity to get your questions answered and just see what your options are with that. So after the class, we're going to open up the rest of it to the other participants with this. But if anyone would like to take an opportunity tonight to be able to be booked, I specifically saved on my schedule a couple slots for anyone who wanted to try and book tonight. If so, Lynn, who's waiting behind the wings here, or behind the scene as my wingman here, she can help give you some options with this. So if you're interested with it, you can put something into the chat and Lynn can tell you what some of the options are with that. Because again, I have a few spots saved right now, specifically blocked for people who show up here tonight. And it's okay if not with that, but otherwise though, at least to get on my schedule, it's going to be still a number of weeks after that beyond those block sessions for in terms of what's available right now. And then extra bonus for scheduling your free consult now, you unlock a special workshop, 15% off, one-time purchase of a package savings with this. And so with this, there will never be a better price on services and products such as the discounted orthotics and hugely discounted treatment packages where savings can be up to $630 with that. So this is only for workshop attendees only with this. So this is truly just an exclusive offer. This is actually deeper than what we've done for Black Friday. And then, as the king would say, thank you very much.